Good afternoon, dear patients. Today we will talk about the treatment of red spots on the head of the penis. If you go to a dermatologist with this problem, as a rule, without even looking, they will most often diagnose you with candidiasis. And at most, they will take a test for sexually transmitted infections from the urethra, not from the head of the penis. As a rule, they won't find any candidiasis. They will prescribe anti-candidiasis medications both internally and externally and leave it at that. Then, if your condition doesn't improve, they will prescribe a hormonal ointment. Most of my patients come to me after going through this process. And if the hormonal ointment doesn't help, then it's on to the next hormonal ointment and the next Triderm, Derm, and other such stuff. Accordingly, it was with a similar problem that a young man came to see me. He had red spots, not very pronounced, against the background of hypospadias. You can watch a separate video on our channel to learn what hypospadias is. So, as it turned out, he had used about 25 different ointments. At the time of his visit, and literally that very morning, he had applied another ointment as well. The last time he used Triderm, but in fact it doesn't really matter what he used. To put it in another way, he has been consistently applying various medicinal ointments to his skin over and over again, and he has been following this exact same routine for a year and a half now. Yet, despite all of this time and effort, those stubborn red spots still refuse to clear up or go away. First of all, when you stop using hormonal ointments, even on your face, everything flares up. There could be a separate video on our channel about steroid dermatitis, steroid-induced rosacea on the face. So, accordingly, this happens even more frequently on the penis. This is precisely the reason why patients who have been consistently using various medical ointments need to be thoroughly prepared before starting. It is absolutely essential that all of these topical ointments need to be completely discontinued for a period of time to ensure the best results. 1. Do not apply anything to the glans for 5 to 7 days, or preferably even longer. 2. Before coming to the doctor, do not wash the glans for 2 days. This is exactly what was done for this patient. As a direct result of these clinical findings, I have decided to conduct a comprehensive series of diagnostic laboratory tests for third sulfate, calcium, and gluconate, while simultaneously prescribing a course of anti-inflammatory suppositories to manage the condition. And I am also providing strict instructions to immediately discontinue the use of all current topical treatments and ointments that were previously being applied to the affected area. This patient came back after 5 days. He had nothing at all on his entire penis. He was pleased and said that no one had ever prescribed this before, and it turns out you just need to not wash the penis and stop using all ointments. I replied that in order to prescribe this, you have to be a doctor. In some cases, I get patients who are completely covered in ointments by painters who know nothing except ointments. As a result of constantly applying ointments, a sort of steam bath is created under the skin surface due to the constant evaporation between the skin and the penis and the ointments. On top of that, they often suffer from allergies, and these factors reinforce each other. That's why even such mild and the prescription of anti-allergic medications, combined with stopping the use of ointments on the irritated skin and eliminating the steam bath effect if the skin hasn't already been damaged by glucocorticoid creams, and this hasn't happened yet. In about 20 to 30% of cases, simply stopping these treatments is already enough for recovery. Therefore, accordingly, I would recommend that if a patient does not experience any effect, then one of the treatment methods is actually to stop using ointments for a certain period, even if it's just for a short time. This is quite an effective treatment method with an emphasis on internal therapy. Naturally, the patient needs to be examined during this period. That is, when you stop applying, it opens up a wide range of opportunities to examine the glans penis directly for Candida, perform bacterial cultures, and so on, which is something a doctor should usually do, of course, before starting any kind of therapy.